So I'm going to show you guys some of the techniques I use for the subscapularis fibers. Now, subscapularis fibers are particularly sensitive on most people. If you've ever had a rotator cuff injury, if you have limited range of motion on the shoulder, if you've got frozen shoulder or any kind of labrum tear or rotator cuff tears, this particular muscle is often in a protective spasm or has a bit of muscle guarding or hypertonicity. To treat that, one of the things I'm going to do is first I'm going to depress his scapula. So I'm going to grab his scapula from with my right hand underneath, drag it forward a little bit, and I'm going to have his palm resting kind of in the crook of my elbow. So once I depress his scapula, I'm going to bring his scapula into a little bit of protraction so that I have easier access with my other hand. I'm going to reach into the axilla and I'm going to look for the border of his scapula, the lateral border. I'm going to get my fingers just inside that lateral border so that I'm now contacting the subscap tissue. And then from there, I'm pressing straight down while stabilizing his scapula with my other hand. So if I stabilize that scapula with this hand and then I come in, I press straight down, he feels a little spicy area. Now that tissue is quite tight. We know that with the scapula in this position, I can access the subscap a little bit easier than if he is to be retracted. So that protraction helps for access. Once we have him in this position and I get a good connection with the muscle and I can feel the density where it's tight, I'm going to gently guide his hand into external rotation. Now, some patients are very large, very muscular, or otherwise difficult to access this tissue. So if you want an alternative technique for this, what we can do is we can bring him into where his end range is, get him to gently push upward. I'm going to resist that. He's going to use about 10 to 30% of his strength, and then he's going to relax and relax. Then I'm going to take him into a little bit of a stretch. So what we've done there is we've activated his subscapularis fibers. We're doing progressive isometric loading. So it's progressive angular isometric loading. So progressively, we're going to bring him into more external rotation. So we're going to have him push again and then relax. I'm going to bring him a little bit further. We're going to have him push again and relax. And we're going to hold this for about 5 seconds once we get to a new range. We're going to have him push again and relax. And so with my left hand, I'm stabilizing his humerus, keeping his scapula depressed, not allowing him to come into too much elevation, not allowing him to compensate. What we're doing here is we're getting the post-isometric relaxation effect from him activating the subscapularis fibers, trying to internally rotate against my resistance. As soon as he relaxes from that contraction, I then bring him into a little bit of a further stretch. So this can be considered a PNF stretch. It can be considered a muscle energy technique. It's also known as a progressive angular isometric loading strategy. You can start from mid-range. You can gradually bring them out depending on their function and their range of motion. So if your patient is, let's say, very restricted and they can only go this far into external rotation, you can start around here. If they're more mobile and you're just trying to get that extra 5-10 degrees, you can start around here. If the patient has a lot of pain, you can use just 5-10% muscle contraction. If the patient has less pain and more just a mobility restriction, you can use up to 50% strength contraction. So this technique can be a little bit versatile, and this is an alternative if your patient is ticklish and doesn't like or can't tolerate direct soft tissue therapy for the subscapularis. It is a sensitive area, being in the axilla. If a patient had any lymph node injuries, or if they are particularly sensitive to this particular treatment, this is an alternative where you don't have to dig into the subscap. You can get length and you can get a positive outcome without having to cause a lot of pain in the session. So that's one of the therapies I use for the subscapularis fibers and to open up external rotation.